Welcome to the Healthcare Plus podcast, hosted by Quint Studer and Dan Collard. I'm Nicole Webb-Bodie, partner at Healthcare Plus Solutions Group. Thank you for joining us as we bring together leaders and changemakers from across the healthcare industry. In each high-impact segment, you'll hear about the latest challenges organizations are facing and learn how guests are rewiring solutions to drive real change. Plus, you'll walk away from each episode with practical tools, techniques, and best practices to implement in your own role and in your organization. For more information on your host or to listen to recent episodes of the podcast, please visit www.healthcareplussg.com/podcast. Now, here's your host, Quint Studer, who will introduce you to our next guest.
Well, welcome to Healthcare Plus podcast. My name's Quint Studer. I'm the host. We're very, very excited today to have Kelvin Hanger, the President, Chief Operating Officer of Good Samaritan Hospital, System Executive Surgical Services out of Cincinnati. We also have Maria Ashdown, Vice President, Chief Nursing Officer at Good Samaritan Hospital, and she's also the Assistant Director of Emergency Services. And we should have been on today on this podcast about 15 minutes ago. We've been on, but I get so excited talking to both of them.
That's good.
Learn so much, their energy. So tell us a little bit, first of all, Kelvin, for our listeners, a little bit about Good Sam, the size of it, number of employees, and if just so they know a little bit about the scope of the system or the hospital size.
Yeah. Good Sam is a 607 licensed beds. We have just under 5,000 team members at Good Sam Hospital, and been around now for 173 years. So we've been around a while, but it's such a great establishment here in Cincinnati.
Teaching facility, comprehensive stroke center, very high acuity OB, women's cancer. Those are some of our NICU. NICU.
Yeah. In your emergency room, how many?
51,000 patients annually. Very low pediatric. We're lucky we have Cincinnati Children's right here. So all adult, geriatric. And then we have a behavioral health hospital inside this hospital as well.
No, I think for our listeners, I always find if you can find places where you think it should be hard, but they can do it, it helps set patterns for you. So we're talking about a big hospital, a lot of patients, complex acuity, 5,000 team members or employees. That's a group, a large specialty group. As you said, Kelvin, you were talking to anesthesiologists just last night at a meeting. So I appreciate that. And so when you look at and knowing Good Sam for a while, you've been on a stair-step approach. I think both of you are relatively new, Maria. How long have you been there?
Yeah, I just celebrated my in May. It'll be May 4th. I'll celebrate my second year as a CNO here at Good Sam. But I've been in the system as a system leader for the EDs over 5 years and in the system about 14. So, but this role.
Yeah. And so for me, I just celebrated my 3-year anniversary at Good Sam and then 11 and a half years at TriHealth.
So you come into an organization and, COVID, other reasons, the performance in certain areas, let's just use employee engagement or patient experience, wasn't exactly what you were hoping for, which many organizations have. But you can't go, we love this good to great, but sometimes it's even not good. Sometimes it's less than good. And yet you have people that are very passionate. It's not usually lack of will. It's sometimes processes, sometimes skills. So you've had some nice stair-step approach, and I like what you've done because it's been methodical. I find organizations have this big sizzle and celebrate. They've moved so quickly, usually follow with a bit of a fizzle because they're putting so much energy into this one area, which sometimes means they weren't paying attention to some other energy, So why don't you just talk about, Kelvin, start out to turn over Maria about the process you have followed to move some of your performance metrics.
I think that number one, and I think we probably both hit on this, is really taking a look, and in some instances, a new look, making sure we have leaders in the right role. It makes all the difference in the world to have a leader that really takes ownership of their department. I think we took a lot of time, even if they were new leaders, we weren't hesitant to, really use a priority list. To try to get leaders, if they weren't in the right role, but they had potential, we didn't want to lose them. And so we figured out how to manage moving our leaders around.
I think one of the things that is unique, I think, for Kelvin and myself is that we're very aligned and very connected. And so when we make decisions, it's not Maria Ashdown making a decision about the division of nursing. It's our executive team making sure that we're all moving in the same direction. These leaders are the guardians of our culture. And it's really important that we assess their skill and also make sure they're teams that are representing us. And that's really important to us. We love these teams. We also are okay when somebody makes a decision that this isn't the work they want to do. That's okay. They can't stay in the role. And so I think those are conversations you have to be comfortable to have. And we agree on them.
Yeah, and I think one of the things that we learned as leaders would go out on whatever type of leave, we always had a backup. So leaving a department really open from a true leader standpoint, covered while someone's gone, we learn from that. So now when somebody goes out, there's absolutely somebody that steps in to make sure things don't slide while they're gone.
I think also we learn a lot. Sometimes when somebody leaves, a new person comes in and discovers things that we...
That's right. Fresh eyes.
Fresh eyes. Going back to Kelvin, something you said, because with leaders today, and probably always, this idea, I have so much on my plate, I'm overwhelmed. You talked about helping managers prioritize. What approach do you guys use in that prioritization? Because they come in with their whole to-do list and then everything's an A priority. Tell us about how you work with your leaders to make things doable.
Yeah, I think, we say really focusing on the priority work, I think really does mean something. We have a lot here at Good Sam that's part of our culture, a lot of acronyms. We have serve values, we have the TriHealth way, and we have always behaviors. And a new leader can really get lost in which one's important and which one am I supposed to do when. So really having not just that leaders one up, but ambassadors around our leaders, helping them understand and obviously knowing that at any moment they can come to us for clarity.
We have a new leader onboarding that Kelvin and the executive team do. So we pull all new leaders together. And so that's nursing, it's support services. And so it's really good because they start as a cohort, really, if you will, and they talk about what are they struggling with, what is work they can't. Sometimes they just struggle figuring out how to organize their day because they get so overwhelmed. And so we meet and we give them tips on how to prioritize and organize. And at the end of the day, our big rocks, our goals are their goals. So, we have 8 or 9 initiatives, and that is the focus. We need to focus on that, and we have tools to help us meet those initiatives. But at the end of the day, we really talk about this is nice to do, but this is have to do work. And so I think that's important.
Yeah, we had a leadership meeting actually this week, and out of 127 leaders that we have in Good Sam, we only had 2 new leaders with us that hadn't been here the month before. And one of the things that we say out loud every chance we get is look around you, look at other departments. Leaders are sitting right next to you. This is your work family. That we have so much talent that are willing to share how they did something around patient experience or did something around team member engagement. Let's use internally what we have.
That's right.
Let me ask you a question on that, because I think one of the advantages of being big, even within Good Sam, let's pretend there's no TriHealth. Let's just pretend Good Sam. You're big enough with enough departments that there's probably people in your organization. Maria, for example, I was in a hospital in New Jersey, and a lot of the new leaders were struggling, particularly in nursing, with scheduling.
Yeah, sure.
They had some real experienced nurses in scheduling, yet they were reluctant to go ask them. It almost took senior leadership to match a little bit. I mean, how do you, and this has always been, I've been in this a long time, and getting people to ask for help in healthcare. And in healthcare leadership is pretty isolated. When you got your
lonely.
You're
a lonely job.
You're a leader on a unit. So how do you encourage people? What do you do to get them to actually talk after you say you talk to each other?
Yeah, that's funny you say that. I'm mentoring a couple of nurses at our sister hospital, Bethesda North, a couple of managers, and I brought some ideas up about scheduling specifically. So a couple things for me. One is I've done the job, right? So I've been the staff nurse, the charge nurse. I've been the manager. And so I have some anticipatory questions that I know they're going to ask because there are the questions I asked myself. I also meet with these managers, my experienced managers regularly to tell me what's working well, what isn't working well. And the orientation that we have for a new leader is created based on the team that's doing the work now. And I think that's really important because they are, they can help guide. And then the other thing is I've got to build support in the bandwidth and frankly the span of control of these nurse managers is large, and it's and I have to give them resources to do their job. I don't need a nurse manager to understand how to put a pencil and piece of paper together for a schedule. They need to understand the schedule, create the schedule, understand productivity. But the actual work can be done by lots of other people. It could be a lead unit coordinator, it could be a lead scheduler. And so our job is to make sure they have the resources, which is what we do. And so scheduling is one of the first things that we talk about with a new leader specifically. And we have scheduling support people to help them because they need to understand the structure and how to create it and what a normal staffing pattern looks like, but they don't need to understand the tool to put it in a system, if that makes sense. But the bigger issue is, I think, that they need to we have service lines and we have ambassadors. I'm going back to the ambassadors that are within the service line. And then we have an ambassador outside of the service line to really make sure that we're touching on these teams. How's it going? Here's what frustrated me. Did this frustrate you? Where's your battery? We check batteries all the time. How are you doing? Because your battery can swing from full to negative very quickly. It can exhaust you. And so the other thing is, I think that people have to understand you got to give them a minute. You got to give them some grace. They're not going to run as soon as they start, and most of these people we put in these roles are high achievers. And a lot of them, when I give them compliments, they say, yes, but. And I'm like, stop right there. I need you to stop right there. If you're struggling, just accept the compliment. And if you don't think you've done anything, let me give you a list of what I've seen you accomplish. I have to fuel them to make sure that their bucket is full. They understand how far they already have come and that we're going to get there. But they don't want to disappoint us. They get so worried about disappointing us. And I'm like, you're doing great. You're doing great.
I think one of the things I recommend to healthcare people all the time is be kind to themselves.
Yeah.
They're much rougher on themselves than anybody will be. And I agree, Marie. It's hard to give somebody in healthcare a compliment. They almost want to argue with you and push back a little bit, instead of just say thank you. Tell me about this ambassador for people that's, the last ambassador I knew, I worked for Rambler years ago and they had an ambassador car. But tell me, when you say the word ambassador for our people that might not have that job title, what is an ambassador at Good Sam?
Mm-hmm. Yeah, I'll start out with a new team member for sure. So when someone is hired on, outside of their direct leader, they are teamed up with what we call our ambassador program, which is someone in their department that really acts as a buddy, not to tell them what to do, but to tell them how to function in the role. Where
put your
where do you
clothes
park?
or
Where's your yes.
Yeah.
And we assign that before they're hired. So someone reaches out to them, says, hey, I'll meet you in the parking lot. And, it really just is that personal touch. There's a lot of anxiety, on your first day. And they take that away. Then you go through orientation and now you're sitting on your unit and you forgot how to log in. You forgot how to, I was going to sign up for benefits, but I wanted to look at something. And so it's that individual that can just sit there and not necessarily give you instruction on your role, but help you, guide in the system.
Yeah, we have a preceptor, right? That preceptor helps do the orientation. We have unit-based educators. They help make sure you're on path. The ambassador really is like the welcome. It's the person to feel inclusive. Most of them want to do it. We don't have to ask people to be ambassadors. They're like, hey, I'll be that. They remember what it's like to be new. They remember. And so it's a great little program. And they oftentimes are the teams go to them for maybe they're just struggling, like this shift isn't working, I feel exhausted all the time, and sometimes they help navigate those. Well, let's go talk to the leader, or did you try this, or here's a daycare person that I use, or just just stuff like that. It's just these are people who volunteer to do this. They want to be part of something, but they don't necessarily want to orient the new hire, but they want to help acclimate them, if you will, to their unit.
And tell them about, we've taken it up a notch. I think Maria has done this, which has been a great addition. But occasionally we have people that float into other departments, and we were getting some feedback that maybe they didn't seem as welcome, move into another department. And so
floating is stressful for nursing units, right? Anyone does it. I mean, you're working on a unit, your people, your routine, and then all of a sudden, gosh, now you got to go to another unit. And sometimes it's necessary. And so we have assigned every day, if there's a float person, if there's someone coming from another unit to your unit, we have assigned an ambassador, both an RN and an ACT, to welcome them and do all the things. We have a little checklist actually to make sure they get lunch, make sure they get breaks, make sure they know how to use the phone system, just where things are, because it's stressful enough. These jobs are hard, and then go and take you out of it'd be like Kelvin and I all of a sudden floating down to, another hospital for a day and say, okay, do your job. You don't even know how to get there. And so, I mean, it's really important that we do that work, and feel inclusive to the team. They're helping you. And so, you need to thank them.
I appreciate that. Maria, you were, I think, in the room when I did a workshop just on the models of care study.
Yeah.
We found is one of the top 4 anxiety creators for nurses is floating. Now, not means they don't want to do it, but they just have anxiety about, like you said, new unit, new people, new procedures, where I'm at. So I think that's just brilliant for people listening. I just think if they aren't doing it, this whole idea of an ambassador for floaters is just, I think it's just absolutely
huge opportunity.
Brilliant. Great work. So you covered really well how you work with the less experienced people, the amount of support you give them. Talk about, again, moving performance with when you look back now this last year, particularly, you have some metrics that have moved up. What's a particular metric and metrics matter. I always get people say, well, I don't understand numbers. Yes, you do. You understand all sorts of numbers. They're positive numbers. And it's just, you don't understand numbers you don't want to understand, but they do matter. So tell me a couple areas that you've seen some really nice improvements you feel really good about.
One that kind of directly reports up to me is in our peri-op space around the OR. They were, as we were coming out of COVID, a very, very strong group, very, very strong leaders, but they, went through this time where they brought in a lot of new team members. We used to think experience was, in that 7 to 8 year range. And now, we look at 1 to 2 years and, oh my gosh, you have all this experience. Well, their team member engagement was actually really low, even though the surgeons loved working here at Good Sam. And so really just over the course of a year and a half, we saw them literally go from the 30th percentile up to the 90th. And we had some movement in a couple of the leaders, mostly around CS, our central sterile supply area, that was really causing stress in the OR. So once we took care of that, it really took care of the whole department. And they, as we sit here today, continue to be extremely strong, both in the engagement of our team members and our surgeons.
I think you guys, again, knowing you a little bit, have made some really nice improvements in engagement. And, you've really done well with that. And I appreciate it. Sometimes you fix one thing, you fix a whole bunch of things. You're an expert on figuring that out. That's why I've learned so much from you. So, Maria, when you look back this year, what's a certain area,
I think for me, it would have to be experience scores. And I've a couple that I'm really proud of. Med-surg specifically, we had to make a decision on a leader in the med-surg area that had some opportunity I like. And so we switched out some leadership, and this team is risen to the occasion. But what I appreciate most about it has been some of those hard conversations. Accountability is, a word that people get sick of hearing, but at the end of the day, do some coaching of your teams and holding them accountable for some expectations. I think sometimes that's a hard thing to do as a leader when you're faced with, a 30% vacancy rate or something like that, and so I think we probably made some bad decisions during COVID. Maybe took a candidate or two that we probably, I wasn't hear them, but my assumption is they kind of felt like that was their only choice that they had. And so, you pay now or you pay later. Selection is key. And so making some hard decisions, holding some teams accountable, making sure everyone knows the expectations and the why behind it. I think when you talked about data, one of the things, having ED background, which everything is metriced. I mean, from the time a patient walks in the door to the time that patient leaves either our building or goes upstairs, everything is timed. When I became a CNO, I quickly learned that there weren't dashboards necessarily for the inpatient units on length of stay of their patients or how long it took for their order of their tray to the time their tray arrived. All of those things we can look at data. And so hold your teams accountable and then start looking at those things that maybe drive your experience scores and then don't work 7 of them. Work 1 or 2 things. Do a deep dive on what matters to your patients. Understand what your priority of your patient is, and then let's fix that. Be very intentional. And I think that, again, helps prioritize the nursing leader. It helps prioritize the staff. Sometimes we throw, today we're going to do this, and tomorrow we're going to do that, and the next day we're going to do this. And hell, the team doesn't even, they're like, well, I thought we were doing that. Oh, no, we should stop doing that. Today we're doing this. And so I think some of that is not necessarily always the right thing for the team. And so for me, the med-surg team got very intentional on expectations on bedside shift report and then hourly safety rounding. And also we've just added, one of the things I'm most proud of has been the unit coordinator work, because the unit coordinators sat at these desks at these med-surg units and they'd answer the call light and say, they'll be with you in a minute, or so I'll send someone in. What does that mean? And so the unit coordinators are now the guardians of responsiveness. And so they're going, and we've spread it system wide. They are going in the morning and they're meeting every patient on the med-surg units and the tele units. They're meeting every patient. I'll be answering your call light. I want you to know my face and I know your face. And they're very specific. I'll send your tech in and she'll be there in 4 minutes, or maybe it's 7 minutes, depending on what the length of time is. Can you wait that long? Those kinds of things help drive your experience, but also keep the patient safe and good quality. So
I love them. The Heath brothers have did some research and showed 80% of success is clarity. And when people say things like, I'll be right with you, what does that mean? I'll send somebody in. What does that mean? The other thing that drives me crazy is somebody says, a lot. Well, tell me what a lot is. So I think this clarity is really beautiful. And, since you say this, and you are helping other organizations around the country, even in Ohio, because I was recently up in Northern Ohio speaking to 7 hospitals, and I talked to them about your unit coordinator visiting each patient every day. I just think that is another unbelievably good thing. Because, also it's hard to be critical if I know them, if I've seen them, if I know who I'm talking to. It's more of a relationship versus a transaction. after that I'll be answering your call light. I mean, just all these things you're doing with the whole idea of just and digging into data. And the other thing I shared, Maria, with this organization that has 7 EDs I was talking to, is I gave them your number because and not that this is their number, you have your number, but you blew me away one day when you shared that number to me that you almost had down to the minute, that if this person's here this long, their experience is going to fall off the cliff. You want to talk about that? I thought that was just genius.
Yeah, depending on which ED you're in. If you're in one, so we have 6, right? And I have small EDs that are arrival to bed in 3 minutes. If they stay out there past 3 minutes in those smaller EDs, their experience scores will never be a 9 or a 10 ever, because they have this expectation. In the flagships, my bigger EDs, it's after 27 minutes. 27 minutes in that waiting room. For every 10 minutes after that, that score is going to go down. And it's proven by data. And that's why pulling till full, those philosophies and that urgency. And when you can't, you've got to touch those patients at least every hour, sometimes more frequently than that, or you're never going to recover them.
Yeah, I was in California and they had an ED that was all of a sudden showing better results. And, it's better to have a conversation when people are feeling good. Because they're sure. Well, so I said, wow, you must be doing something different, because I want them to feel safe. And if they're not, you go in when they're not getting results, they're very defensive, the whole bit. So I said, well, just out of curiosity, is there anything you're doing that you think's making a difference? And one of the nurses said, well, we said we were going out to the waiting room and keeping people informed, but we really weren't. We are now going out every so many minutes just to let them know where we're at. And so those types of things really matter. How about the other one, the 4-hour and 20-minute one? Do you remember that conversation?
Yeah, that's funny. So those patients, those are admitted patients. So remember, those admitted patients impact your hospital score. And so if you have a length of stay greater than 4 hours and 20 minutes at my flagships, every place is different, obviously, your hospital score is never going to drive to top decile. It's just not going to get there. And so we put a lot of work on making sure when that disposition goes to admitted, that patient gets out the door we ask for assigned bed in 15, out the door in 45 minutes. And it's strong work. It just has to happen.
What I love about what you showed is you showed the inpatient operators who might look upon the ED as a separate island.
That's correct.
They need to be working with.
It's all of our problem.
Yeah, if they're not getting the people, if they're not calling the discharge in, if they're not moving the beds, sometimes it's even what you did at Bethesda North was creating additional beds or moving where the beds are. But you showed them the reason why. So I just think if I'm listening to this call, I've got all sorts of, from ambassadors to sharing ideas to the time zone, the removing barriers, the helping new employees. It's really cool stuff. And for all those of you listening, you're probably wondering, these people must be sad and wore out. They're working so hard. But if you know these two, they're two of the most joyful people. I'm looking at them right now, and I keep thinking, what medication are they taking over there, Good Sam? So tell me, you've been in this a while. Both of you have been in this a while. You still bring such joy to your work. How do you replenish yourself, Kelvin?
Without question, something that brings joy day in and day out is having the time to go round on our patients.
No doubt.
There is nothing better than taking an hour, and sometimes we'll set aside up to 2 to go round on patients. And we go up to our nurses station. We say, let's go. They know what we're doing when we come up and go talk to a patient. We want to hear the patients that have had issues. We want to hear from them. And we want to hear, frankly, we spend a lot of time, oh my gosh, please go talk to this patient. They just love it.
They tell us to.
They were with another system and they ended up here through the ED and they just, please go talk to them.
Yeah.
And, as you might expect, when we walk into the room, it really is, they're shocked, number one. And, but it really just gives us insight to what's going on the floor. Because when you're up there, you really get to see everything.
Yeah. Sometimes because this team is like our family. We love them. We love this team. And so we don't want to disappoint them either, right? Like we want to rise up and so when we go to those floors, it's hysterical. Sometimes you'll see us like moving laundry carts because this seems like this could go better here, guys. And so we just want to know what the issues are. We want to what struggles do you have today? And they get so excited when they see us, and so that fuels us.
And when we come back down into our office, I mean, we're like, oh my gosh, that was so great. It's like it's the first time we do it every time. Mm-hmm. We feel that good.
Mm-hmm. It's fun. It's just fun.
Well, it's really, really marvelous. And again, I know you want every hospital in the Hamilton County, Cincinnati area to be wonderful. However, I just read some recent reports out. They named the top 20 healthcare systems in the country from a consumer perspective.
Yeah.
And this was an outside company that was measuring consumerism across the United States of America. And TriHealth has cracked the top 20.
I think we came in at 18th.
I think we're 18th.
Yeah. There's some big players in there like Johns Hopkins, Mayo Clinic.
Mayo is in there. Right. Yeah, we saw.
It's pretty neat. And it's significantly higher than some other organizations. And not that you don't want them to be high. You want everyone to feel good. But to me, when you feel the consumerism, that means you have access, because access is about consumerism. And when they are they're having an experience. And then you get that word of mouth that is sort of magical. So I just saw that. I think I just read it today.
I got to tell you a funny story about consumerism. We talk about this. So when Kelvin and I round, we always leave our business cards there with them. It has our cell phones on them. And so a couple Friday nights ago, Kelvin calls me and he's like, Maria, do you remember that patient we saw in 49 today? I said, yeah. She just called me on the phone. I go, it was like 9:30 on a Friday night. Yeah. They were having, it was her daughter. They were having trouble getting her IV line. And she wondered if I could help her.
Right.
And he said, I called you. So what we did, we sent anesthesia and then got it started
right away.
But it was the first time anyone called us. We were so excited. Out of all this time, we passed all our cards out.
Thousands of cards.
But she said that I followed up with the daughter on Monday, and she said we will never not go to another hospital.
Yeah.
Because of that.
It's pretty incredible.
I forgot about that. It was so fun.
Pretty incredible. And again, I get to talk to you guys and see it and hear it. And I just wanted to help all these other people. Because again, I know your goal, our goal. I know Mark Clement, the CEO at TriHealth. He's always been great about sharing best practice.
Absolutely.
Yes,
he's always been great. I guarantee if you're a Cincinnati hospital, even, and if you call these two, they would tell you what they're doing, because we want to we learned lessons during COVID and how we were all better off.
So great.
Together.
And I know in the area, this is another show, but in the area of equity, in the area of some of the stuff you're doing for lowering the infant mortality, reduced in Hamilton County, by all working together.
Yep.
So,
no doubt.
Thank you guys. I appreciate it so much.
Thank you, Quint.
Thank you.
We're going to have a lot of patients getting better care because of what they can learn from each of you. So thank you very much.
If you would like free resources and access to our latest books, articles, and industry insights, visit our website at healthcareplussg.com. We hope you'll join us next time as we continue our journey to make healthcare better for caregivers, patients, and communities.